This is Bringing Better Health to Life, brought to you by Conway Medical Center. My guest is Dr. Michael Rosenblum. He's affiliated with Waccamaw Cardiology. And so let's find out what he was doing before he came to Conway.
Well, I grew up in Charleston, just down the road from here. Spent pretty much my entire life there until undergraduate. Went up to Charlottesville, to the University of Virginia. Majored in biology there, and then went actually to San Francisco for a year and did genetic research, and then went back to Charleston for medical school. Went to Manhattan after that for 3 years of residency at Mount Sinai, and then went back to Charleston for cardiology fellowship, and then after completing fellowship started at Waccamaw Cardiology.
Well, you've certainly been in some beautiful communities in your young career already. Dr. Rosenblum, let's talk a little bit about the specialty that you have brought to Waccamaw Cardiology.
Well, one of the things we're real excited about here is the radial heart caths that we're doing. So a lot of times patients will get a heart catheterization either because of a heart attack or because of they're having chest pain or heart failure, and classically they were done through the groin, and afterwards patients had to lay flat for up to 6 hours. They had sometimes there are bleeding complications, and through the radial cath, we go through the radial artery instead, and the patient's able to sit up immediately afterwards, and if they're awake, they can walk around immediately afterwards. So the patient comfort is definitely improved with this technique. And then we've actually seen overall in the studies less bleeding complications as well.
Oh, you know the patient must love it, and obviously you as doctors too.
Patients love it, and you know, they're very excited to find out they can have that done here.
How long have we been doing this?
We just started them here probably in August, and we were doing them in Charleston, and I'm not sure who else is doing them in the area, but we're certainly one of the first groups to be offering this treatment. And
let's explain to the folks who are watching why you would even have this done. What brought us to that point?
Well, most people have heart catheterizations done to look at the arteries that supply blood to the heart, that allows the blood to pump blood out to the body. And what we do is we inject dye into those arteries and take pictures of them through X-ray. And that way we can provide stents if they need them in the heart, or bypass surgery to help either improve the heart function or prevent heart attacks.
Mm-hmm. Do you do that after the analysis of, after you do the radial artery test, after you do that, then do you diagnose what needs to be done? Or if while you're in there you realize there's a blockage, you can do it then?
Usually what we'll do here is we'll take the pictures and see what kind of blockages there are, and then we can either send the patient over to Grand Strand Hospital or to MUSC or any other hospital that does percutaneous interventions or stents, as well as sending patients for bypass surgery.
Mm-hmm. Even though you're a very young doctor, I'm sure that even in just the past couple of years, you've seen changes in cardiology that have to amaze you.
Absolutely. I know when we were finishing fellowship, we had something called a left ventricular assist device, which is basically a pump that helps patients with end-stage heart failure. The radial heart catheterizations, there's new 3D imaging for echocardiography, CT scans of the chest and the arteries of the heart, as well as new uses for MRI as a way to screen for heart blockages.
Mm-hmm. Every year there's something else, and isn't that good news for all of us? We're going to take a break, but when we come back, Dr. Rosenblum is going to continue with us here on Bringing Better Health to Life. Stay with us.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
Our guest is Dr. Michael Rosenblum. He's affiliated with Waccamaw Cardiology. And we were just talking a little bit about going through the artery rather than the groin, and that was fascinating. But talk about some other things that are new and some of the things that you're doing that's innovative in your practice.
Well, we're doing a lot of new stuff with echocardiography, which is ultrasound of the heart, whether it's to look at the function of the heart or the heart valves for people with valvular heart disease. But in the office we do 3D echocardiograms, and it's probably one of the most common procedures we do in the hospital, as you know, there's no radiation involved and it's pure ultrasound. And we get a lot of helpful information from those studies.
Who usually needs something like that?
Anybody with valvular heart disease, heart failure, swelling in the legs, or anybody who's had a heart attack before to see what the function of the heart looks like.
Mm-hmm. When you say heart failure, how does that term differ from heart attack? I think there's probably a lot of people who confuse the two.
Right. So heart failure is a clinical syndrome of shortness of breath, fluid in the lungs, not being able to walk very far, not being able to lay down flat at night to sleep, swelling in the legs, and it's usually the most common cause in this country is at least coronary disease, or someone who's had a heart attack before and either wasn't treated or the treatments didn't work, and they're left with a heart that doesn't function very well. We see both problems with the heart pumping, and we've in the last 10 years really discovered that people have what's called diastolic heart failure, where the heart pumps okay but doesn't relax very well, and it causes some of the same symptoms.
We've talked with some of your other partners in the practice about some of the warning signs of heart disease, but have you ever seen anybody come in who really had no family history, they didn't smoke, they didn't drink, they exercised? I mean, heart attack can hit anyone.
Absolutely. I think about 95% of people, we have a good idea of who gets heart attacks, like you said, people with high cholesterol, smokers, diabetics. But then we see every once in a while someone who doesn't have any of that, who has a massive heart attack, and that 5% of the population is we're still trying to figure out why that happens to them.
Michael, what are some of the other causes of heart failure?
So besides coronary disease that we talked about before, two of the most other common reasons we see heart failure, one is valvular heart disease. So a patient has a leaky mitral valve or a leaky aortic valve, which can lead to heart failure. The other cause we see, probably the second most common cause, is a whole group of causes that aren't due to blocked arteries. One of the most common causes we see of that is a viral illness, that the patient will have a viral illness and they'll recover from the viral illness, but then about 2 to 3 weeks later, sometimes sooner, they'll have heart failure symptoms of shortness of breath and swelling in the legs. And it's not completely understood, but it looks like some of the antibodies we form to fight the virus can actually attack our own heart and lead to heart failure.
I would imagine there are a lot of people out there who are listening to this and they have some symptoms and they just don't know what to do from there. I guess the procedure is to always talk to your internist, your general practitioner. They recommend you to see a cardiologist, but they shouldn't put it off. It's better to be safe than sorry if they're having anything that they think is heart-related.
Absolutely. We have some great internists in the area, and they're very, very good to get them in to see us quickly if they have any of these symptoms. But like you said, the most important thing is to call your doctor. Don't wait till the symptoms get really bad. You know, if you're feeling any shortness of breath or any, chest pains, just to go ahead and call your doctor, not to wait.
I imagine there are a lot of people too who just feel that, oh, I'm getting older, I'm tired, I'm more run down, I'm out of breath, and they blame it all on age. But they probably shouldn't, because a lot of that could be blood pressure related and heart related. Absolutely.
Getting old is not a reason to be getting chest pains and shortness of breath and not being able to do things anymore. So, a lot of people think that that's just part of the aging process, but it really shouldn't be.
That's a great place to end. Dr. Michael Rosenblum, thank you so very much for being with us, and best
You're
wishes
welcome.
here in the community with Waccamaw Cardiology.
Thank you.